right, thank you, Steph. Most students in Ontario are back in class, but already the province has reported 75 schools with at least one case of COVID-19, plus one full closure due to an outbreak. Are these numbers expected, or should we be concerned? For more on that, I'm joined by pediatrician and founder of Kid Crew, Dr. Dina Kulik. Good morning to you, Dr. Dina.
Good morning.
I want to just begin with the numbers here and get your reaction to this. I know you've been following it for some time, and as a pediatrician, looking at the younger generation and whether or not we knew these numbers were coming.
Yes, I mean, we saw the numbers creeping up over the last few weeks. I think a lot of us thought that when school started and kids were back in potentially big-sized classrooms that we would have a surge in cases, but this surge actually preceded when a lot of the bigger school boards were going back. So a lot of us are kind of bracing for increased numbers day by day until we get things under control.
When we look at, I actually want to bring in a tweet from a viewer because we put this out there to see if anyone had any back-to-school questions, both flu or COVID-19 related. And someone wrote this, Michelle, writing, do kindergarten kids really need to wear a mask all day? She says, you know, they get very few breaks. They're coming home glassy-eyed, dehydrated, exhausted. I want to get your take on that.
Well, I'm not sure why they'd be coming home, you know, teary-eyed and dehydrated per se. They should still be eating and drinking throughout the day. Many kids are doing just fine with masks. We know that even before we went back to public and private schools with daycares being open, we actually did okay with these little ones in small groups not wearing masks. So we're not really sure how much it's very important for every single grade. We certainly know that small groups make a difference. So you know, your classroom that has 30 kids in it, for example, masking will prevent droplets from leaving your body, leaving your face, and could potentially decrease the spread. There isn't harm. I mean, as far as, you know, annoyance goes, certainly masks are not that comfortable. But by and large, I'm seeing that kids don't care about wearing masks. It's their parents that are looking at them and saying, you know, this is not the JK experience I had. This is not the grade 3 experience I had. But kids don't seem to mind as much as adults do. They're doing just fine.
I want to get your take on some of the symptoms here. We saw in BC their checklist. And any parent who is sending their kid to school now knows that they have to put in a checklist. Do they have a runny nose? Do they have chills? Do they have fever? All of this. They've reduced what's been on that checklist and taken away things like a runny nose or I think what are one of the other symptoms. But they've reduced the list significantly. Do you think this list should be reduced right now in Ontario? It's quite lengthy.
I don't. I think the best approach personally is a conservative approach. I think it's hard to say, we know it's hard to say whether a child has COVID or a common cold or the flu. And even a simple runny nose has been reported to be a sign of COVID. And not only that, but there's many people with COVID that have no symptoms whatsoever. So we don't need fevers. We don't need sore throat. We don't need cough to have COVID. I think a more conservative approach is the best, you know, case here because we want to decrease the rise in numbers, and conservative will lead to that much better than being more relaxed.
Dr. Kulik, you are part of a push here with a number of pediatricians who have signed this petition. When it comes to the flu vaccine, we know flu season is right around the corner. Are we prepared to see flu season and COVID together?
Many of us were hopeful that in the Southern Hemisphere, we did not see a dramatic rise in flu cases this year. They typically, you know, have their flu season in Australia, for example, about 6 months before us, and they did not have a lot of cases of flu. However, their COVID rate at that time was very low. A lot of the time they were in quarantine, they were masking, etc. As we see the numbers of COVID cases rise, many of us have concerns that that means that kids are also potentially exposed to flu because the prevention is the same for COVID and for the flu. If we see more COVID cases, we will probably see more flu cases. And it's more difficult now to give enough flu vaccines in our offices because we're minimizing how many kids are coming through the doors. We can't have mass clinics. We have to maintain space between patients, clean the spaces, etc. So we worry that we won't have enough space or ability to provide all the flu shots that we need this year. And that's why we're reaching out to governments and also public health facilities to help us make a plan to deliver as many flu shots as possible to the kids that need it and the families that need it.
Okay, and this petition is going to be delivered to the government, I assume?
Correct.
Okay, so we will stay tuned with that, Dr. Kulik, because we know flu season is right around the corner, and with COVID intersecting together, this could be a bit of a disaster here. So let's hope we can avert that. Appreciate your time today, Dr. Kulik. Thank you.
Thank you. Be well.